Good morning, Dr. Michael White here, coming to you from Chiropractic and Rehabilitation of Miami Lakes. And today I wanted to make a small video explaining one of our most common injuries. That would be the disc herniation. And to explain what a disc herniation is, I'd like to start off with the anatomy of the spine, and then we'll kind of go from there. So I'm going to start by showing you what a disc is, where the vertebrae are located in the spine. So within the spine, from the cervical spine, thoracic spine, to lumbar spine, you have these vertebral discs. They are a soft cartilaginous material that prevents the bones from rubbing bone on bone, allows free movement of these bones as well. But what can happen is the inside of these discs can misplace, and that's what we would call the disc herniation. So when you have a disc herniation, it could be caused from different type of traumas, that being a fall, an auto accident, possibly a sports-related injury, or even over time, degeneration of the spine can then lead to destruction of these discs, which may lead to a disc herniation as well. And to kind of explain using a smaller model here, when you have a herniation, it's basically when the inside of the vertebral disc protrudes out. And when that happens, that is going to put a lot of pressure onto the spinal nerve. Now, as you can see here, the inside of the disc, which sometimes I use the analogy of a jelly donut, that when you take a jelly donut and squeeze it, the jelly is going to move out to the area of weakness. So that, in this case, would be the back portion of the disc, which would then put pressure onto the spinal nerves. So when you have that pressure onto the nerve, that is when you're going to start to experience a lot of symptoms such as numbness, tingling, pins and needles, burning sensation, all in which it can travel down to the upper extremity, and possibly if you have these herniations in your lower back, they can travel down to your lower extremities. Very common. I do get patients that come in explaining that they're having one-sided pain that travels down the shoulder, sometimes into the fingers, mostly the numbness, tingling, and burning types of sensations. So the reason for that is when you have a herniation, it can be on one side of the disc. So for example, if you had a herniation on the left side of your disc, you are more than likely going to experience pain that may refer down the upper extremity on that one side, whether it be the neck or the lower back. Now, the proper diagnostic tool to use to diagnose these injuries are an MRI or even a CT scan. X-rays may show some degeneration, but it is not going to properly diagnose the disc herniation. Now, the next big question that I get is, are these types of injuries treatable without having to do surgery or maybe an injection of some sort? Yes, they are treatable injuries. I myself have had these injuries in the past, and they are very complex and complicated injuries, but like I said, they are treatable. In understanding the nature of these injuries, it's good to understand how these injuries can become inflamed to avoid these type of flare-ups. We do types of treatment that may reduce inflammation, bring motion back to the spine, and the biggest thing is help reduce the pain naturally without the use of medications, without the need of surgery, and so on and so forth. We offer treatments such as chiropractic care, massage therapy, physiotherapy, such as ultrasound, muscle stimulation. We also offer mechanical traction beds that do such a great job as far as removing a lot of that nerve interference by bringing motion back into the joint. We are here 5 days a week, Monday through Friday. If you would like to call us to make an appointment, we do offer same-day appointments. The best number to reach us at is 305-570-1965, or you can get more information on our website at www.chiropracticandrehabilitation.com. My name is Dr. Michael White. I hope you enjoyed this and hope you have a great and wonderful week. Take care.